Saddle up for a wild ride, Vet Girl Pack. We're headed to the heart of Music City for Vet Girl U this summer. So mark your calendar to join us for a rootin' tootin' good time, June 27th to 29th, 2025 at the Renaissance Nashville Hotel. We're bringing the heat with hot chicken, honky tonkin', and some seriously amazing CE. Registration opens soon at vetgirlontherun.com. Hi, Vet Girl here today, and super excited to speak with Dr. Tina Wismer, who's a board-certified veterinary toxicologist. She is a guru in all things toxicology. She's also a master gardener, which finds a special place in my heart since I'm an avid gardener too. And today, we're going to talk about what's new in toxicology. Tina, thank you so much for joining us today.
Thank you for inviting me.
We have so much to talk about. In fact, I'm so excited because you and I are going to talk about one of my favorite topics, fluid therapy and the poison patient. But before we do that, do you mind just giving us a little bit of background about who you are, where you train, and what you do now?
Sure. So I am a Purdue graduate, went back and started in small animal practice, then did emergency medicine, and by some strange twist of fate, ended up at the ASPCA Animal Poison Control Center. And I have been here since 1998.
Time flies by when we're having fun, right? It's crazy. All right. Well, I'm super excited to talk to you because, as you guys know or may not know, next week is actually National Poison Prevention Week. And while this originally started in human medicine, most of you guys are probably too young to remember Mr. Yuck, the green face. This is something that ASPCA, Animal Poison Control Center, has always also helped promote because we always want to educate our pet owners on what they can do to help prevent pet poisonings. So, Tina, really excited to be able to talk to you right before National Poison Prevention Week. And, before we begin, I did want to talk about what's new in toxicology. Like, what are the biggest updates?
So, few things going on here. Probably one of the biggest things is an increase in psychedelic mushroom exposures in pets, especially dogs. And typically, when we think of psychedelic mushrooms, we think of the psilocybin mushrooms. But what we've really noticed is an increase in these Amanita muscaria mushrooms. And why are we seeing this increase? Well, these products are unregulated by the FDA, and they've become very popular to put into things like chocolate bars. And what do dogs love to eat? Chocolate, right? So our critters are getting into these and they're having the typical GI signs, right? Vomiting, diarrhea, drooling, but they're also having almost a serotonin like signs, right? They may have tremors, they're tachycardic, they're depressed. And the good news is they respond really well to symptomatic care. But when you have that kind of just weird, spacey dog that comes in, ask about mushrooms too, in addition, of course, to THC, which is still quite popular out there. The other thing that we've seen an increase in recently are dogs getting into chewable Apoquel. Okay. And when we think about Apoquel, these chewable tablets are very, very tasty. So tasty, in fact, that cats are getting into this too. And we're seeing GI signs, of course, but also these weird ocular signs, right? We're seeing edema, we're seeing third eyelids up, and especially in cats, we're seeing acute kidney failure. So definitely this is something that if they eat one pill, it's not a big problem, but always, always please tell your owners to keep these away so that they don't get into the whole bottle.
Awesome. So good to know. Especially having worked in poison control too, I know like all those chewable veterinary medications, we oftentimes don't, or we're too busy to tell the owner, hey, make sure to keep this out of reach. And, for you and me, it's always those chewable NSAIDs that even cats will get into. The owner throws it into the dog bowl, the cat walks over and eats it. And again, so important that we be cognizant of that. There were a few questions on a recent ASPCA webinar that I wanted to ask you about. And to me, for years, I've always been lecturing on how we still didn't know what the active ingredient was for grapes and raisins and vitis species. And, leave it to COVID for us to find out because parents were trying to think of ways of being quote unquote working parents while taking care of young ones at home. And who would have thought that you guys would see a spike in cream of tartar poisoning because most people don't have cream of tartar in their house unless they're bakers, right? Like they're baking meringue, they're making, homemade Play-Doh or things like that. So tell me what the ASPCA Animal Poison Control Center discovered when it comes to Vitis species for those of you out there who haven't heard about this.
Yeah, so we've known for years that grapes and raisins can cause kidney failure in some dogs, but we had never known what the toxic component was. And as you said, during COVID, people had to entertain their children, so homemade slime, homemade Play Doh became very popular. And most of those recipes were concerned about the salt content. But for a while, it became popular to add a large amount of cream of tartar to these products. And what happened is we had dogs eating this homemade slime with cream of tartar, and they ended up in acute renal failure. Enough that we actually had some dogs die and they went for necropsy. And the pathologist noted on the report histopathic lesions are the same as we see with grape and raisin toxicosis. So that set off the hey, okay, what is cream of tartar? And it turns out it's a byproduct of winemaking, right? So when we make wine, tartaric acid is found in grapes and raisins and in other fruits like tamarinds at really high amounts. Now, when we make wine, we actually remove the tartaric acid because it precipitates out, looks like ground glass, and no one wants that in their glass of wine or in their jelly. But they then sell this tartaric acid to the baking industry. So, looking back in the literature, and literally looking back, these papers were from 1913 and 1931. We found studies where they gave all of these different species tartaric acid or potassium bitartrate, right? And what happened was they developed acute renal failure in the dogs, but not other species. So we kind of lost that knowledge for years. Now, when we first thought, hey, maybe this is tartaric acid, a group of scientists actually took some dog kidney cells in a petri dish and added tartaric acid to it and showed that, yes, tartaric acid causes acute kidney failure in dogs. It did not do this in the human cell lines. And what they have determined is that dogs are deficient in these OAT4 transporter molecules, right? So OAT is organic acid transporters. And we've always known that dogs excrete organic acids very poorly. And it turns out it's because they don't have this molecule. So what happens with tartaric acid is it accumulates in the renal tubular cells and causes their death. So, long way around, we finally know that tartaric acid is the toxic component in grapes and raisins.
Awesome information. Huge, huge discovery by ASPCA. Love the science behind it and love just the hypothesis, again, because we never saw cream of tartar. So I guess that's one good thing that came out of COVID is you guys discovered what the AI was or the active ingredient. All right. I did have another question on an emerging or a newer toxicant or drug that we are seeing more in veterinary medicine that a lot of people may not know how to manage. And that is related to sodium glucose transporter 2, or what we call SGLT2. And for those of you guys who aren't aware of this inhibitor that's out there, it's used for the treatment of uncomplicated, newly diagnosed diabetes mellitus in cats. And if you've never heard of it, SGLT2, it's kind of a mouthful, but it's basically a protein on the kidney tubule, right on the cell surface. And it helps basically pull glucose into the kidney filtrate. I did want to ask you, are you guys seeing any kind of issue, again, because we see dogs getting into chewable products all the time. I did want to ask, are you seeing any kind of SGLT2 inhibitor poisoning in dogs and cats? And was wondering what clinical signs you see, what's the prognosis, and how do we treat it?
So with overdose situations, we're seeing your typical GI signs, right? Vomiting and diarrhea. These animals are lethargic. We're also noticing that they do have glucosuria. They tend to be hypoglycemic, hypokalemic, And of course, they can develop this ketonuria. Some of these animals are highly affected and they can die from this.
even if they aren't diabetic.
Correct, right? We always look for our DKA and non ketotic hyperosmolar syndromes in our diabetics, but we can see similar effects happening in non diabetic animals with overdoses.
Awesome. So, people always hate me when, they ask me a toxicology question, and I always say it's symptomatic supportive care, which I know people hate, but short of appropriate decontamination, which we'll talk about later, it truly is symptomatic supportive care. To me, I sort of categorize it into five areas. One, fluid therapy, which we're going to talk about later. Because our goal with that is to help hydrate the patient, perfuse the patient. Maybe it's to help vasodilate the renal vessels in case they got into an NSAID that causes a potent vasoconstriction. Maybe it's just to help with tubular flow. Maybe it's to help, minimize that myoglobinuria if they're tremoring. Maybe it's to treat that hypotension. So aside from appropriate decontamination, it's fluid therapy. The second thing is cardiovascular support. If they're bradycardic, check a blood pressure. If they're tachycardic, check a blood pressure. Maybe they need an antihypertensive. Maybe they need a beta blocker to slow down that heart rate. Maybe they need atropine or glycopyrrolate to increase the heart rate. The third thing is neurologic support. Are they tremoring? Maybe they need a centrally acting muscle relaxant. Are they seizuring? Can you give them whatever anticonvulsant you have? Have you checked a blood glucose if they're seizuring, right? And then besides fluid therapy, cardiovascular support, to me, it's also neurologic support. And then sometimes it's weird miscellaneous medications like hepatoprotectants or antidotes if available. And then the last thing for me is often GI support because every single toxin seems to have vomiting and diarrhea. So maybe it's an antiemetic so they don't aspirate. So again, while I don't want to simplify it and say treating the poison patient is truly symptomatic supportive care, it truly is, right? If we know that SGLT2 inhibitors can result in, GI signs like vomiting, diarrhea, we're going to treat that. We have to be able to monitor them, right? So we're going to check a glucose, we're going to check for ketonuria, we're going to check electrolytes, and then we're going to treat it appropriately. If they're hypoglycemic, we're going to treat them with dextrose therapy. Any other recommendations you have for treating this newer drug toxicant when accidentally ingested in dogs or cats besides that?
I think you've hit it on the head, right? We don't have a lot of antidotes in veterinary medicine. And if we do have them, maybe they're too expensive, right? Because it's always about the money. So, yeah, it's treat the patient, not the poison. Sometimes these animals don't read the book, right? We may think, oh, we should become hypoglycemic, right? But sometimes they go the opposite way. They become hyperglycemic, right? So you treat the patient in front of you, not what's in the textbooks.
Awesome. Thank you so much. And I didn't realize that you guys saw such a huge spike in psychedelic mushrooms. I mean, I still remember this from my undergrad days, but when it comes to mushrooms, in the past 5 years, the ASPCA Animal Poison Control Center has seen a 1,500% increase in cases of pets being exposed to psychedelic mushrooms or even gummies. So that to me just is mind blowing. So absolutely crazy. You know what?
Yeah,
It went from pot to now psychedelic mushrooms.
they've become very popular as holiday gifts for some reason.
I don't get it. All right. Second big question. Talk to me about cholestyramine versus charcoal. And I will say, in full disclosure, I use activated charcoal more than ASPCA does. But talk to me about when do we use it? Why? Which one? Pros and cons. More importantly, while we try to practice evidence-based medicine, in full disclosure, and totally correct me if I'm wrong, both of these modalities fell out of favor in human medicine in the 70s, right? And we're still using them. And I personally think it's because in veterinary medicine, we're restricted by financial means of the pet owner. So we can't always just put them on hemodialysis. We can't always, just sign them up for plasmapheresis. So human medicine, they're more likely to do that. So talk to me about it. What should we be reaching for?
Sure. So activated charcoal and cholestyramine both have their uses. And you're correct, right? In human medicine, they may say, oh, charcoal only binds about 20% of this toxin. So why should we bother? Well, in vet med, If we combine 20%, that may put us below a lethal dose, right? Or below a dose where we're going to see kidney failure. So certainly it's important in our management because, as you say, it's always about the money. So when do I use charcoal? So I still reach for charcoal first with most toxic situations. Okay. And many times what we'll do is we'll give an initial dose of activated charcoal, and then we may switch to cholestyramine. Now, what cholestyramine is, it is a resin that binds to bile acids. So it can become effective with toxins that undergo enterohepatic recirculation, right? And that enterohepatic recirculation has to be due to binding to bile acids. So the number one thing we use cholestyramine for is vitamin D, right? Or cholecalciferol toxicosis. So we know that vitamin D has to be bound to bile acids to be reabsorbed, and we can break that enterohepatic recirculation. The other couple of toxins we've used it for are sago palms and some of our longer acting NSAIDs like naproxen. Okay. Now, if you just have, a dose of ibuprofen that, is above a renal dose, we're going to typically just give one dose of charcoal and not bother moving past that. Some of the reasons that we now use cholestyramine instead of charcoal is that fluid shifting that we can see with all the osmotic components that are found in activated charcoal. And that doesn't happen with cholestyramine. So each still has its place in veterinary medicine, and just pick the most appropriate one.
Awesome, awesome information. Thank you. All right, the last one. We've had multiple email exchanges about this, and you and I are probably on the same board when it comes to fluid therapy for the poison patient. And, there's this big movement right now, mostly, if not 100% unfounded, on not using fluid therapy for the poison pet. And as soon as we heard this, like immediately my hairs on the back of my neck went up, and I had to reach out to you because unfortunately, some of the human medicine references or resources that this newer hypotheses stem from have been misquoted. If you actually pull the paper and you read the papers, that's not what these papers are actually saying. So talk to me about what's up with the no fluid therapy for poison patients movement. Again, you and I totally disagree with this as toxicologists, but talk to me.
Yes. So the concern with too much fluids, of course, is fluid overload and damaging the glycocalyx, right? So that can cause increased inflammation and, other systemic signs. And the people that are promoting, don't use fluids are correct in the fact that they say it doesn't increase excretion of toxins. That is absolutely correct, but that is not why we're using them. We use them for NSAID toxicosis because NSAIDs, of course, when they deplete the good prostaglandins, they cause vasoconstriction of the afferent renal arterioles. So to make sure that those remain open, that we get good blood flow to the kidneys, maintain our GFR, we're going to put them on a rate of fluids. Now, are we just going to put them on a twice maintenance rate of fluids and not monitor ins and outs? Absolutely not, right? You're going to adjust your fluids as needed. In the case of things like grapes and raisins in dogs or lilies in cats, right? When those renal tubular cells die, they actually plug up those tubules. We're dealing with an obstructive nephropathy, right? So once again, fluids are important to kind of, I guess for lack of a better word, flush out those tubules, right? Keep them open and keep urine production going. So we've been doing this for, 50, 75 years without seeing a huge increase in mortality. So now the switch to, hey, don't give these guys fluids really kind of makes me a little tachycardic.
I couldn't agree more. It's interesting because I always joke in veterinary medicine, things fall in and out of favor every, whatever, 10 years. And for those of you guys who have been practicing long enough, you will discover that, right? And, it's just ironic and funny because I've been practicing for 30 years and I've seen things come in and out of favor. So one of them is classically nebulization. And this is unrelated to fluid therapy, but, for a while it was nebulized with saline, then it was nebulized with furosemide, then it was nebulized with antimicrobial therapy. And when it comes down to it, part of the reason why these things come in and out of favor is because there's no right answer, right? And sometimes there's not necessarily evidence behind it. So I do totally agree with you when it comes to practicing evidence-based medicine. Ideally, of course, we always want to practice evidence-based medicine. But I'm going to say straight out, there is no solid evidence of this in veterinary medicine. In fact, I always say, God forbid you ever brought up to the Board of Veterinary Medicine in your state or province. The general rule is you're backed up by board certified specialists or what's in the veterinary literature. And you know what's in the veterinary literature? Using fluid therapy. Because Tina and I have published those textbooks, and granted, they're older. But again, it's like what I mentioned before. We don't have the same luxury in veterinary medicine versus human medicine, because unfortunately, a lot of the time in human medicine, when we're seeing a poisoning case, it's a child, it's a suicide attempt, human medicine has to ethically treat, regardless if they have no insurance. We don't have that option in veterinary medicine. So again, it's really those five things of symptomatic supportive care. It's fluid therapy, cardiovascular support, neurologic support, GI support, and miscellaneous therapy. I won't give away the name of this brilliant criticalist from Tufts, but I heard her lecturing at ACVAM in Minneapolis in 2024. And I loved what she said when it comes to fluid therapy. And that's my general philosophy too. In general, if that patient has normal kidneys and it has a normal heart, it is relatively hard to volume overload in hospital with normal kidneys. All right. And that's because your kidneys are going to pee it out. Right. So unless it's a 15-year-old or a 10-year-old miniature poodle that has, chronic valvular heart disease, it's been on enalapril. Yeah, I'd be super scared to put that patient even on half-strength saline with 2.5% dextrose to make it an isoosmolar fluid. If it got into a nephrotoxicant, you still have to be really, really careful. And like Tina, what you mentioned, fluid therapy is not set it and forget it, right? It's not just like everybody goes on 2.5 times maintenance. You're assessing it based on PCV, total solids. Are they hemodilute? Did they gain weight if they're dehydrated? Did you actually calculate dehydration, add in maintenance, convert it from liters or the deficit to kilograms or grams, add that weight onto the patient to assess the patient? Are you examining them multiple times a day? Are you doing what I call the jiggle test, where you put both hands on the side of the sub-Q and jiggle the dog? If they're becoming jiggly, they're overhydrated, right? You have to look for those signs. So I couldn't agree with you more. The huge movement right now to not use fluid therapy in the poison patient, in the opinion of animal poison control centers, is erroneous. Okay. And I think the key thing to keep in mind is you're right. Classic number one drug I see, SSRI antidepressants, right? We see that serotonin syndrome, you putting them on fluid therapy, it doesn't make them pee out the toxicant anymore, right? It doesn't undergo urinary elimination, but that's not the point. The point is it's this dog that's usually a Yorkie for some reason. No diss to Yorkie owners, but it's usually a Yorkie that's got a temperature of 105.5. It's got massive tremors. It's, got massive mydriasis. It's really what I call wiggity. You're putting it on fluid therapy because you're trying to flush out that myoglobin, right? From them tremoring so severely, you're trying to cool them down from that hyperthermia secondary to tremoring. And again, Tina and I aren't putting them on fluids because we want them to pee out the toxicant. The drug doesn't work that way, right? Your goal of fluid therapy is to treat the other clinical signs. And I would love for a resident to do this as a study, right? But it's also hard because it goes against evidence, right? It goes against the evidence in the textbook to flip a coin and say, hey, we're not going to give you fluid therapy. That said, there was a recent paper that came out by Erica Reinecke at University of Pennsylvania on the use of traditional inpatient therapy with fluid therapy for lily poisoning versus those that did not get IV fluid therapy, right? Ideally, we always preach they need fluid therapy. It's a nephrotoxicant. But realistically, in West Philly, not all clients can afford it. So they get sub-Q fluids and are managed that way. They recheck at the referring vet. And it was an awesome but limited study because they were able to interpret some of that data to be able to evaluate it. Of course, there's always limitations of retrospective studies, but that said, it does go to show you, work with your pet owner as best you can. If I can't speak for Tina, but if my dog got into a nephrotoxicant, or if it got into a psychedelic mushroom or marijuana or a drug that does not undergo urinary elimination, heck yeah, I still use fluid therapy. So again,
Me
depends
too.
on the case. Yeah, it depends on the case. We also, sometimes we want to do it because they're too sedate or I made them sedate. They're not going to have oral intake. We want to minimize that hypernatremia that we can rarely see with charcoal. And all important reasons to consider.
Dogs in the hospital have a lot of insensible losses, right? They're panting, and it's crazy how much fluids that they lose. So we know we cannot accurately demonstrate 5% or less dehydration, right? So we do need to go ahead and make sure that these guys do remain euvolemic.
Love it. Love it. The last thing I'm going to add, and this is my own personal inappropriate boasting, is knock on wood, I've never had one of my patients develop hypernatremia from charcoal. And the reason why is because I put them on fluid therapy. I give them a dose of a potent antiemetic, whatever you want, ondansetron, meropitant, as soon as they are done vomiting from my emetic agent. And I start my charcoal, but I also give them a bowl of water because they have rapid return to oral water. And Tina, you totally nailed it. I always joke when I see some of my staff syringing charcoal into the mouth. What is the dog doing? Right?
Throwing its head around. Yes.
Exactly. They're panting constantly while they're trying to swallow charcoal. They're panting the whole time they're hospitalized. They lose so much free water. And then I hear people say, oh, he just got charcoal. Don't give him any food or water. Right. And then we're depriving them of oral water. Right. Any dog with an intact brain and intact kidneys, their thirst mechanism is going to go off before they become hypernatremic and they'll drink water. So, again, little last plug for oral water, sub-Q fluids, or even fluid therapy. But in general, we do believe they need some type of fluid therapy.
Yes. You're preaching to the choir here.
I know. All right. Any last tidbits or tips from the ASPCA when it comes to any new updates or keeping our pet owners and their pets safe during National Poison Prevention Week next week?
Yes, this is a perfect time to send out newsletters or hit the media and truly push prevention. Prevention is way cheaper than having to treat those poisons. And as I like to say, that new puppy is not your old dog. So they make them cute for a reason because they are bad.
Awesome, awesome information. I live in Minnesota. Our top three dogs are typical hunting Labrador retrievers. They're German short hair pointers or golden retrievers. So if you see a lot of Labrador retrievers, it's talking to the pet owner about the importance of making sure these dogs are crate trained appropriately as puppies. Right. It's making sure that we educate the owners on how to keep those weekly pill holders out of reach or keeping the counters clear for those counter surfers. Obviously, we see other breeds and other, species that are getting into toxicants. But again, I believe it's 90% of your calls to ASPC are dogs. Is that correct?
They are. Yeah, dogs are busy. We unfortunately, with our lives, are too busy too, and we don't get them enough exercise. We always say a tired puppy is a good puppy. But yes, it's all about prevention.
Exactly. And for those of you guys who are interested, toxicology is obviously a passion of both Tina and myself, but we are releasing an updated version of the Ultimate Guide to Toxicology next week. So you definitely want to check that out. We're going to have some updated articles in there, including emergent toxins and updates in clinical veterinary toxicology. We're going to have a lot of awesome articles, including ones about food poisons, which are one of the top 10 poisons we see all the time. And I know, Tina, you briefly touched on, I guess, both mushrooms and chocolate, but those articles will be in there. We'll also have some great articles on the top poisons that kill. Most poisons don't kill acutely, right? There's very few, but you better know the ones that kill acutely, right? So organophosphates, ethylene glycol, 5-FU, we'll talk about isoniazide, and none of this sounds familiar. You got to know it. Right. So you definitely want to look at the Beckerel social media or your email campaign to get that, sign up for that toxicology book. And it'll also have an awesome hepatotoxicant and nephrotoxicant chart in there. So definitely something that you want all your staff to read. Tina, thank you so much. Always love chatting with you. I'm so glad we were able to finally do this because we've been talking about it for years since this fluid therapy movement happened.
Yes, it was great to get together.
Thank you so much.
Thank you.